Hey Village, in this video, I'm going to tell you guys about a situation that happened a couple of months ago. John and I were open to respite placements as well as emergency foster placements, and we got a call for an emergency foster placement. Ultimately, we ended up saying yes, but when the child got here, we realized that we were not going to be able to take care of them. So I want to talk to you guys about what transpired and what lessons we learned. And this is a video where I'm going to be talking in generalities. I'm not providing any specific details, and I will make sure that our agency approves this video before it goes out to any of you guys. In this video, I'm going to be speaking in generalities and probably going to be a little bit vague because we do want to maintain the confidentiality and privacy of this child. And our hope in sharing this situation is that you guys can possibly learn from it and avoid maybe some mistakes that we made. So early this year, John and I were open to emergency placements, which means they're getting a kid into their care. They don't have a foster family identified long-term, or they're identifying kinship, but it's late in the day and they need a place for this child to stay for the night or maybe the weekend. And this isn't necessarily ideal because that's another stop that the child has to have on their way to a more permanent placement. And every disruption is going to create some trauma. So for example, a child comes in at 3 p.m. after school, the agency has temporary custody, they can't identify a foster family that is able to take the child, or maybe they need some time to talk with kinship. So they're looking for a foster home or a respite home that can have the child stay with them just for a night or two while they get some things in order. So the child would be meeting that family, would be getting settled in for a few nights, and then they would have to ultimately move again. So it's not ideal, but it does happen. This also can happen when you have kids who have maybe some challenging behaviors or medical diagnoses where they really are trying to find the right family who can support them, and they just need that extra time to find the right fit. So early in the year, we get a call for an emergency placement. Our agency knew that we were on a little bit of a break and that we wouldn't be open to more permanent placement calls, but we did still want to help. So when we got that placement call, initially I was listening to the caseworker, and the things that she was describing, I thought, well, I think we can handle that, but I was a little questionable. There were certain child characteristics that were just things that we haven't dealt with in the past. Not to say that we weren't willing to try, but I wasn't sure if we were going to be the best family to support that child. So I remember telling the caseworker that, I really didn't feel like it would be a good fit and that I was really hesitant. But if they couldn't find anywhere else for this child to go, to give us a call back and we would, maybe reconsider and see what we can do. And unfortunately, there were no other homes that they could identify. And so they did call us back. I asked some extra questions. John and I talked at length about what we felt comfortable with, if we thought that the challenges were something that we could handle, and kind of got a game plan because it sounded like it would only be for like a weekend, 2 to 3 nights. And this is the part about being a foster family. When you get a call, your heart is almost always going to want to say yes. Even if your heart is big enough, it doesn't necessarily mean that you're the best suited for that child. So ultimately we said yes, and we had a few hours to get things in order. I think that before Darcy got off of the bus, I was setting up the room, setting out different things. I like to put a blanket and a stuffed animal and like some books and just some extra things for the child, always based on their age, their gender. If we can learn anything about the child, we'll try to incorporate those things. But this is why we have like a little bit of a stash in our basement ready to go so that we can personalize. Of course, that's not something that you need to do. We just like to shop on clearance and at garage sales, and we try to find these good deals and just kind of set them aside and give them as gifts. Make sure that a child who's coming to visit with us or to stay maybe more long-term, they feel welcome, they feel wanted. We want things to feel like home. And I realize that's impossible because it's not home, but I think you guys get what I'm trying to say. You want to try to make it feel welcoming. I think that's maybe a better term. So I get everything set up. Darcy gets off of the bus. I talked to her about what's happening and what to expect, and she's getting all excited. And I should mention that this is like very early in January, so we still haven't fully unpacked everything from the holiday season. So honestly, I just had like piles of the kids' presents that they had opened from grandparents, from us. They were just kind of all over the place. So our home, I would say, it was a little chaotic. And I mentioned that because it did become an issue when the child came to our home. But anyway, so I'm getting Darcy kind of used to the idea that, a child's going to be coming to stay with us. This is where they're going to be staying. Do you have any questions? This is what we know. That sort of thing. And she was excited. This is something that at this point, Darcy understands that we're a foster family and what that means when kids come to stay with us. She's almost at the point where she's going to be involved in those placement call discussions. But ultimately, it is going to be our decision. So we know our children and we know whether they're ready for it. That's also part of the reason why we've taken such a long break, just because right now Sawyer is not at an ideal age to incorporate somebody else into our family, even if it's temporary. He's just kind of a wild card. So it's been nice to have this break where we can just focus on his development. Yeah, 2 is a really tough age. It didn't seem to be when Darcy was 2 because I think we were like in the process of fostering. But I think when we have Darcy and Sawyer and everything else going on, it was a little too much. So anyway, this is the downside of not being scripted, is I go off on a lot of tangents, but here we go. And this is where I have to be careful about what I say, because I do want to be really respectful of this child, even though I'm sure nobody outside of the caseworkers would be able to identify this child. It's still just something that I don't want to give too much information. So the child and the caseworker came, and actually I think there were 2 caseworkers who came, which ended up being a good thing. I could tell when the child came in, the behaviors that were indicated in the referral, in the placement call, I could kind of see some of those, and I was like, okay, that's fine. We can get used to that. But I think the fact that our home just really wasn't well put together that day, like I said, we had piles of toys. I think it was a little overstimulating. And what ended up happening is, obviously kids are kids, and when they see toys, they're going to be like, oh my gosh, look at these toys. We're fine with that. I can always talk to Darcy because, this child maybe picked up one of Darcy's presents. And I explained to Darcy, yeah, just share, we can figure it out. So yeah, we were just we were observing, we were trying to get used to them, trying to talk to them, really try to connect a little bit. And everything was pretty much okay up until a moment where things started to escalate. My work desk is kind of like in our living room. It's like right when you first enter our, the front door. And it has glass doors with Funko Pops and little fun little things. And it caught the child's eye, and they began trying to climb the desk. And because the doors were glass, we were worried that they were going to maybe break the glass, harm themselves, and just the situation kind of escalated a little bit. And based off of the child's characteristics, it's not that the child was doing anything wrong. We were trying to adapt, and I was trying to talk to the caseworker about what was acceptable for me to do to, de-escalate and keep her safe from those glass doors. And ultimately the caseworker stepped in and kind of lent a hand, and I was just kind of watching. I think it's really important when a child is first placed with you, really notice how the caseworker is interacting and how the child's responding, especially if they have maybe some more challenging behaviors or, medical diagnoses. And when I say medical diagnoses, I'm also referring to mental health diagnoses as well. So the caseworker was ultimately able to de-escalate the situation, and we were proceeding with the different paperwork. I think while I was interacting with the caseworker during this, I think John was giving Sawyer a bath. I'm pretty sure, oh no, he was giving Darcy a bath because, oh my gosh, I forgot about this. Maybe my story is totally wrong because now I'm remembering, I think that there was an accident that happened. So as the child and the caseworker were arriving, John had to give Darcy a bath. And so while the escalation happened, John wasn't there to witness it. And so I was just there with the caseworkers. And I think Sawyer saw it too, actually. I think he was kind of playing off to the side, and he was in the room as well. But so that was something where I was like, you know, okay, we're a traditional foster family. Because we have 2 young kids, there are certain things that we haven't had to deal with. So at some point, we ended up going down to the basement. And again, our basement is kind of set up. There are some glass display cases for John's red stuff, and then there are just toys everywhere. Again, this is no fault to the child, but the behaviors that I was witnessing, it was starting to become more and more apparent that it was a little bit more of a severe case than they had thought. And I had asked the caseworkers while we were in the basement, I said, you know, have you observed this behavior? And they said no. And I remember vividly just being in the basement with the 2 caseworkers next to me and watching this child who, you know, is a child, you know, who has some behavioral issues, some mental health needs, that I could see that it was going to be a really big challenge for our family. I know Darcy, and as much as Darcy is such a fun-loving kid, she also is very protective of her things. You know, she was the only child for a few years. She likes things a particular way. And I could just see that if this child were to stay with us, it would be a huge disruption for Darcy. Not to mention, again, as we were learning just in that drop-off, the child needed a lot more care, a lot more one-on-one care than we were going to be able to provide. It would have been a totally different case if this was like 10 years from now and our kids are older and a little bit more self-sufficient, and, you know, for the weekend we could absolutely accommodate a child who might have higher needs. But in that moment, I just came to the realization that, you know, us saying yes on the phone to the child characteristics and what they knew at the time, and then having the child come and seeing much different behaviors, much more extreme behaviors, I just had to tell the caseworkers that I wasn't sure if we were the best family. And I remember immediately starting to cry because I knew what that meant. I knew that they didn't have another foster family, and so I didn't know what would happen to this child. And the fact that the caseworkers, you know, spent all this time identifying us as a placement, and now it's, you know, after dinner and they're back to square one. You know, I can't share the mental health needs, the behaviors, that sort of thing. So, you know, I do understand that some people are like, you could handle that for a few days, but like, we know what we can handle. We know our family, and it was just something that I know that we wouldn't have been able to do. So at that point, I like pulled myself together, and again, like, I feel awful. Like, the amount of guilt, you know, it's one thing to have guilt when you get a placement call and you say no, but to actually have the child there and realize that it is not going to work, that was like a whole nother level. And it was the first time that we've experienced it. We still were able to help in a small way. We were able to pick out a new outfit for the child. I had them, you know, look at our rack of clothes that's downstairs and pick something out. I think they really, really liked it. And we also were able to get them cleaned up. So we got them a bath. And even that was, it was a challenge. And, you know, the caseworkers were there with me as I was, you know, attempting to, you know, help this child, get them cleaned up, get them some fresh clothes. But I guess what I'm saying is they saw the behaviors that were going to be a challenge for us with 2 existing young kids in our home. But ultimately, we got them cleaned up, and we got them dinner. They ate dinner. I think Darcy was kind of confused at the whole situation. And also during this whole time, I think as I'm getting them cleaned up, the whole conversation in the basement, John's upstairs getting dinner ready for the kids. So I come back down after, the child's all cleaned up and in fresh clothes, and I had to kind of give him an indication that the child would not be staying and that I would explain later. And then after dinner, as the caseworkers were trying to figure out what to do next, there was another incident that kind of escalated where the caseworker stepped in and, was trying to de-escalate. Like, I think I was trying at the time, but just honestly, we didn't have the skill set at this point in time to support this child. And I remember when they left, like, again, just like the amount of guilt that I felt, even though I knew that it was the right decision. Like, when you're in this role as a foster caregiver, like, you want to help everybody. And being faced with the fact that you can't help everybody and that, you could do more harm than good just for the sake of trying. Like, that's a hard pill to swallow. And so I share this experience with you guys because this happens. And of course, we're against unnecessary disruptions. And I don't even know if you would call this a disruption because, we signed the paperwork, but the caseworkers didn't even leave. But we will always clarify that, like, it's not the disruption, it's the fact that, like, was everything done to prevent the disruption from happening? And for us in that moment, I knew, like, we were going into a weekend where there wouldn't necessarily be caseworker support. We would be with this child who, again, we don't know how to properly support them. It just wasn't the right time for us to take a chance and have a child come in that could potentially hurt themselves, possibly even get into it with Darcy. I could see, just based off of the interactions, the child was a little bit bigger than Darcy, so it wouldn't have been intentional. It wouldn't be from like a malicious place, but just the fact that it was a bigger child, and along with some of the other behaviors and things that we knew. And ultimately, I feel like I should have trusted my gut. When we first got the placement call, I just didn't think that we were the right fit. But out of desperation and knowing that they had nowhere else to go, I thought we could give it a try. Yeah. And so I learned, John and I both learned that if we don't have the right information for the placement call, you have to look at what information you have. And yeah, like, sometimes you're going to take a risk. And I felt like that's what we did. And, this time it didn't work out. I also wanted to share this just to show you guys that we are not perfect. We are not always the best family for kids who are needing placement in foster care. We have made mistakes. You guys know that. And honestly, the only thing that we can do as foster parents and foster caregivers is just to learn from it and try to make a better choice in the future. And I did talk with our caseworker after this incident because it was weighing really heavy on my heart. And I talked to her about, like, why we didn't feel it was a good fit, hoping that it would help with future placement calls, because we didn't want them to think that we were the type of people who would have a child come in and then immediately turn them away. Like, that's definitely not who we are. But at the same time, we're a new family in their agency, so they don't really know us. So I wanted to make sure that they knew really where we were at and that we were taking it as a learning opportunity, that we would not make these decisions lightly. Not that we did in that circumstance, but that we don't make them lightly, and we were going off of the information that we had at the time. I'm trying to think of anything else to share about this experience. I think I shared as much as I can. And, again, I know some people are not going to understand, but most of you will. I know most of you will understand that you have to acknowledge that there are limitations in the support that you can provide. And also, just to be clear, we need more treatment level foster homes. And what that means is foster families that have a home environment that are able to take in higher need kids. When we talk about there being a shortage of foster homes, I think they're not talking about the homes like us, at least in our state. In our state, we do have foster families, but the placement calls that are coming to these counties are for kids who have higher needs. And if you take John and I, for example, we have 2 young kids who, young kids in general have higher needs. So they take up a lot of our time and energy and love. We also work full time and we have things that we're up to that take time. And right now our home is just not set up for that. I do hope that in the future, like 10, 15 years from now, I hope that we are still fostering and that we'll be set up to maybe take in those kids. But right now it's just not a fit for us. And it would honestly be such a disservice to these kids to put them into a home that can't support them. As usual, I'm overthinking the fact that I didn't do a good job explaining this. But again, I know there are so many of you who have watched our family, have heard our stories. You know our hearts, you know our intentions. And so I appreciate you guys listening. I hope that this can be a lesson for others to just ask the questions, maybe trust your gut. I mean, sometimes it's okay to take a risk, but in the moment, like, you're gonna know if this is something that you can do or if it's something that you might need extra support, or maybe it's just not even gonna work. And that's okay, because there are gonna be other foster families most often that will be able to support them. And if your county has a shortage, help recruit foster families who are able to accommodate kids with higher needs. And with that being said, thank you so much for watching. Make sure you like and subscribe, and I'll see you next time.